Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I have been a cardiologist for 40 years. The feature presentation is What is Killing Heart Patients? We're going to take an in-depth look into what are the things that are increasing the mortality in patients with heart disease. So let us begin with the feature presentation. These are the risk factors: age, family history, ethnicity, male gender, high blood pressure, cholesterol, smoking, diabetes, lack of exercise, overweight, and diet. And here I have summarized all these conditions. Of course, you can change your age, you can change your family, you can change your ethnicity, you can change your gender. Maybe today you can change your gender. But for the most part, your genetic makeup is fixed. So, what are the things that you're doing that is not right, that is giving you hypertension, high cholesterol, smoking, diabetes, obesity, diet irregularities, and lack of activity? And all of these combined together increase your risk of heart disease. I'm going to show you slide after slide as how it is within your own control to reduce your cardiovascular risk, improve your quality of life, and improve your longevity. First, let us look at smoking. Here are people who never smoked, women and men. Here are men who never smoked, and look at the current smokers, their risk of heart disease from 8 to almost 15. Smoking doubles your risk of heart disease. If you can cut down your smoking, you can reduce the risk of heart disease by almost 50%. As a matter of fact, 1 year after you quit smoking, your risk of cardiovascular complications are same as that of a non-smoker. So there is a tremendous benefit in taking smoking cessation very seriously so that you can drastically reduce your cardiovascular events and improve your quality of life. That is far more than any drug can do for you in the long run. So keep in mind, it is both in men and women. Smoking is a major risk factor for heart disease. In addition to having 20 different problems related to the lungs, like chronic bronchitis, lung cancer, nicotine addiction, and all these things. But from a heart perspective, smoking doubles your risk, and by cutting smoking, you can reduce your heart disease risk and cardiovascular events like heart attacks, heart failure, or irregular heart rhythms, or needing pacemaker, things like that, by almost 50%. So there you go. Now you see what is killing people with heart disease and how you can halt that, or you can dramatically reduce that. And let's look at high blood pressure. High blood pressure is another independent risk factor for heart disease. When this study combined the coronary artery calcium, which tells us how much calcium is deposited in the coronary arteries, and that's signifying the degree of coronary stenosis or degree of heart blockages. If someone's calcium score is 0, here as you can see to the left side, their risk of coronary artery disease is very, very minimal, that of the normal population. Whereas if they have a coronary calcium score of greater than 100, some people have up to like 1,000 or 2,000, then the risk of heart disease goes up dramatically. As you can see, the incidence rate per 100 years. If you combine that with blood pressure, now this is just systolic blood pressure, but if you add diastolic blood pressure, it's going to be much more magnified. And a systolic blood pressure of like 100, your risk is about 10-11%, but if your blood pressure is 129, the risk is like 18, which is almost like double. And if you take a moderately hypertensive patient whose blood pressure is 180 over 110 or 200 over 120, then you can understand how the risk of cardiovascular disease magnifies with the elevated uncontrolled blood pressure. And let's look at another study here which looked at systolic blood pressure against total cholesterol. As the blood pressure is cholesterol is lower, the blood pressure is towards the bottom of the three-dimensional image here. However, the risk of heart disease, that's what we are talking about. Risk is 1 if the blood pressure is below 130, but if the blood pressure is 160 plus, the risk goes from 1 to 6.25 times. Now you can see if you can bring your blood pressure to 140 over 59, you can almost decrease your risk of heart disease by 50%. And then by bringing it to 130 over 44, you can almost reduce it by 3 times. So that is the magnitude of how modifying the risk factors can dramatically reduce your risk of cardiovascular events like heart attacks, heart failure, or irregular heart rhythms. But the thing is, we have to take these things seriously and take action. I mean, that is the key word. And again, on this side, we have the cholesterol. As the cholesterol level is the lowest, then the risk is lower. But when you combine high cholesterol with high blood pressure, you can see your risk is almost like 8 times that of a person with a normal cholesterol level and a blood pressure of less than 130. Can you get from here to here or here? Absolutely yes. And that's what this presentation is about. How to identify what's killing people with heart disease and how you can dramatically reduce the risk by bringing your cholesterol down and bringing your blood pressure level down. It all begins with diet, which we'll talk about in a minute, and taking statins or similar drugs to reduce your LDL cholesterol by at least 50% if you're an adult over 45 years of age and have multiple risk factors. And here is another chart looking at LDL itself. When the LDL level is normal, the risk of cardiovascular events is 4.7. If the calcium score is greater than 100, so they'll compare the LDL with the calcium score. And as the calcium score goes up at each level of LDL, the heart disease risk goes up significantly. So what do we do for this? Maybe we can't do a whole lot for coronary calcium, but we can certainly bring down the LDL to normal level, which is now considered to be 70 to 100 milligram per deciliter. This is another chart looking at the 5-year risk of major cardiovascular events with LDL treatment with statin, and here is the LDL level. If we treat these patients with statins, we can reduce the risk by almost 30% from here all the way down to like here by bringing down the LDL level, which is easily done by taking medications, statins and other class of drugs. And as you bring your LDL level down, the risk of heart disease comes down proportionately. Triglycerides is another independent risk factor for heart disease. Here, triglyceride compared with HDL, if you have low HDL, like 10 to 41, some people do, a lot of Indians do have low HDL levels, then depending upon your triglyceride levels, the risk of heart disease goes up significantly. So if you have low HDL and high triglyceride, which is like a common presentation of executives with a big body and with a history of mild diabetes who run low HDL and high triglyceride levels, so your risk goes up significantly. So what can we do about this? Okay, first of all, we need to reduce the amount of calories we are taking. It is the calories, carbohydrates, and fats that increase your triglyceride levels. If we can keep your triglyceride levels below 150, and with exercise and some medications, you can increase the HDL, then you can dramatically decrease your risk of cardiovascular events and thus reduce major complications arising from these risk factors. This is another study looking at LDL. Again, this is the LDL measurement, and here is the reduction in the risk, which was similar to the chart I showed you. Now let's move on to diabetes. What is the story with the diabetes? Diabetes is considered as almost equivalent to heart disease. Patients with diabetes have a very high incidence of heart disease, and it is proportionately related to the hemoglobin A1C. Whenever you go to see a primary doctor or an endocrinologist, they always measure and say, well, you need to keep your hemoglobin A1C below 6.5 because anything above that, you're diabetic and you're not under control. And look at this. When we look at the hemoglobin A1C level, with the minimal cardiovascular risk and with multiple cardiovascular risk, the risk of coronary artery disease goes up significantly. So take, for example, someone who has a hemoglobin A1C of 7 and smoking and high blood pressure, which is not uncommon presentation. The risk goes from 20 to 29. And look at this one. If you have more than 8 hemoglobin A1C, then the risk is almost 3 times that of people with a hemoglobin A1C of 6.5 or less. So what's killing people? It is their dietary habits. What's killing people? It is their other risk factors like hypertension, smoking, obesity, and inactivity, all of which are under the control of the heart patient. So it is your duty to take charge of your risk factors, modify them, and move from this 38.9 per thousand events per year down to 11, which can be easily done. I mean, it's not easy, but when you do it, the rewards are going to be significantly much more than all the hard work you have to put in. Now let's look at another chart here related to diabetes. Looking at females and males. Males are more prone for having increased incidence of cardiovascular disease and complications with diabetes, and especially with the age group getting close to 60 and beyond 70 years. Look at the risk of frequency of ischemic events or heart disease events, 5.2 compared, it's almost 10 times greater in patients with diabetes who have an age which is against them, and if they don't control their diabetes. All right, we get back to the diet. As we get older, we are not doing a whole lot of exercise. Most of our life revolves around computer monitors, and it is a sedentary lifestyle. Here they recommend 2,730 calories, which I think is way too many calories. If you look at your 500 grams of carbohydrates, if you keep eating 500 grams of carbohydrates, you're never going to get rid of your obesity. You're making your diabetes worse. You're going to adversely affect your cholesterol levels, and all of them are going to jack up your blood pressure. Now we have multiple risk factors for heart disease, and I wonder what's causing people to die from heart disease. You see, whatever we do to our body, that's what's increasing our risk dramatically. So I would say we need to keep your carbohydrate intake to like 100 or maximum 200 grams. But again, if you have diabetes, you need to consult with your specialist as to what is the right quantity of carbohydrates. Protein 60 grams are okay. Total fat 30 grams. I don't know if most people can stick to that. But the main thing is the carbohydrates is the major culprit. So the best way to start reducing your weight is start exercising, which is already down here, and then see if you can reduce your carbohydrates by starting 25%. and then go on to 50%. Replace those carbohydrates that you cut with salads and grilled meat, no potatoes, no chips, and no snacks. If you can do those things, you can bring your carbohydrates down. You can bring your blood sugar down. You can reduce your cholesterol level. You can reduce your blood pressure. You can get your weight down, and it will get you off your chair and start walking, because when you see one thing is working better, you want to add more things that can make your life better, and at the end, you're going to be a new you with reduced cardiovascular risk and better long-term prognosis. Let's talk about the diet for a moment. Diet, here's the Mediterranean virgin olive oil diet, a Mediterranean diet. And you can see Mediterranean diet compared to the American diet or the controlled diet. Just the diet alone can reduce your risk by almost 20% here, incidence of cardiovascular risk. So when you understand what is hurting people with heart disease, what is giving them heart attacks, what is increasing their chances of heart failure, you see right here in this chart what is causing those, and it is all within your control, with the exception of eliminating diabetes or hypertension. But you can drastically control hypertension, bring down cholesterol by more than 50 or 60%. You cut down smoking, bring your sugar level down, hemoglobin A1C 6.5 or below, bring your weight down. You will be a different person altogether. Ladies and gentlemen, this is an exercise. Of course, exercise is something which all of us talk about, and we say we're going to do it, but we never get around to do it. And here is like a 27% reduction in cardiovascular events by just getting involved 2 to 4 times exercise per week. 3 to 4 times 30-minute exercise per week can reduce your cardiovascular risk. It will reduce your weight, and it will improve your physical fitness and prevent any osteoporosis chances. So walk as much as possible, park as far as you can, and bicycle or just climbing stairs. All of these can dramatically reduce your risk of cardiovascular events. So ladies and gentlemen, this is a very quick synopsis of what is hurting patients with heart disease and what is increasing their risk of heart attack and death, and what can be done to reduce those risk factors. I hope this has been educational to you. We have a series of presentations on heart healthy lifestyle. Please do watch them, and please do subscribe to our YouTube channel. I will see you in the next presentation. Thank you so much.